Hello, and welcome. Today we're diving in the complex world of neurosyphilis, a devastating condition where syphilis, a sexually transmitted infection, attacks the nervous system. We'll explore its causes, how it damages the brain and spinal cord, its symptoms, diagnosis, treatment, and what we can do to prevent it. Let's begin. Neurosyphilis is caused by the bacterium Treponema pallidum, the same culprit behind syphilis. It occurs when syphilis is left untreated or inadequately treated, allowing the bacteria to invade the central nervous system. This invasion can happen years, sometimes even decades, after the initial syphilis infection. The pathophysiology of neurosyphilis is a complex cascade of events. Treponema pallidum breaches the blood-brain barrier, the protective shield around the brain and spinal cord. Once inside, it triggers inflammation, leading to damage of brain tissue, spinal cord, and the meninges, the membranes surrounding the brain and spinal cord. This inflammation and direct bacterial damage can disrupt normal neurological function, leading to a wide array of neurological symptoms. While syphilis rates overall fluctuate, neurosyphilis represents a serious complication of untreated syphilis. It's more common in individuals who are also infected with HIV, as HIV weakens the immune system, making it easier for Treponema pallidum to invade the nervous system. Groups with limited access to healthcare and consistent syphilis screening are also at higher risk. The signs and symptoms of neurosyphilis are highly variable and depend on the specific areas of the nervous system affected. Early symptoms may be subtle, including headaches, stiff neck, and changes in mental status such as difficulty concentrating or memory problems. As the disease progresses, more severe symptoms can arise, such as seizures, paralysis, dementia, vision problems, personality changes, and sensory deficits like numbness or tingling. Tabes dorsalis, a specific form, involves damage to the spinal cord, leading to characteristic walking difficulties, shooting pains, and loss of reflexes. Diagnosing neurosyphilis requires a thorough neurological examination, a review of the patient's medical history, and laboratory testing. A lumbar puncture, also known as a spinal tap, is crucial. This procedure involves collecting cerebrospinal fluid at CSF from the spinal canal. The CSF is then tested for the presence of Treponema pallidum bacteria or antibodies against it. Blood tests like the VDRL and RPR are also used, but their results can be difficult to interpret in the context of neurosyphilis and aren't diagnostic alone. A positive CSF test is generally required to confirm the diagnosis. Neurosyphilis can be classified based on the timing and specific manifestations. Some types include asymptomatic neurosyphilis, where the infection is present in the CSF without any noticeable symptoms. Meningeal neurosyphilis, involving inflammation of the meninges. Vascular neurosyphilis, affecting blood vessels in the brain. Parenchymatous neurosyphilis, directly affecting the brain tissue itself, which includes general paresis and tabes dorsalis, and gummatous neurosyphilis, which is characterized by gummas or tumor-like lesions affecting brain and spinal cord. The primary treatment for neurosyphilis is high-dose intravenous penicillin. This antibiotic effectively kills the Treponema pallidum bacteria. The duration of treatment typically lasts 10 to 14 days. Following treatment, regular monitoring of CF is crucial to ensure the infection is eradicated. Management may also involve addressing specific symptoms, such as pain management for tabes dorsalis or seizure control with anticonvulsants. It is vital to treat sexual partners to prevent reinfection. Prevention of neurosyphilis hinges on preventing syphilis itself. This includes practicing safe sex, using condoms consistently and correctly, limiting the number of sexual partners, and getting tested regularly for sexually transmitted infections, especially for those at higher risk. Early detection and treatment of syphilis are crucial to prevent its progression to neurosyphilis. The prognosis for neurosyphilis depends on the severity and duration of the infection before treatment. Early treatment can often halt the progression of the disease and may even reverse some symptoms. However, some neurological damage may be permanent. Recent research focuses on developing more effective and convenient antibiotic regimens and improving diagnostic accuracy. Researchers are also exploring the potential role of the immune system in controlling the infection and preventing neurological damage. Continued vigilance and research efforts are crucial in combating this devastating condition.